about the setup for the NeuroTrack Obstetric TENs to use in labour. So basically you get a little kit like this, and to put it on, you just need to open your kit, and you'll find that you've got a machine, a boost button and electrodes, and it should all be set up for you, so you don't need to worry about plugging anything in. What you do need to do is stick things on the back. So basically take the machine and just unravel all the cords, okay, and then you've got your, as I said, boost button here and electrodes here, and you'll notice that the electrodes have been marked for you with an X and a 0, and that's to make sure you get your electrode lead placement correct. So basically what you do is you stick an X on the upper part of the lumbar spine on one side, so just away from the vertebrae or the center of the spine, and you attach the opposite 0 on the other side of the spine. And then when you stick the other two on, you stick it on the opposite diagonal, okay? So the X goes underneath the 0, and the 0 goes underneath the X, so that the sort of area that the TENS affects is this entire lumbar spine region, okay? So there's no perfect placement. It's not sort of a particular line, but just in a roundabout and about the same distance away from the spine. And the theory of the TENS with labour is that instead of feeling all of the intensity from the uterine contraction and the cervix opening, your body starts to hear noise from the spine, and because your brain can't hear everything all of the time, it takes the intensity away from your contraction. So it's a pain management tool, and it has no ill effects in the body at all. So it's not medication or anything like that. So it's a completely natural pain modulation option for labour. Okay, so once that's stuck on like that, you can see the red leads are opposite and the black leads are opposite. Grab the machine. So Felicia, I'll give you that. Okay, and you just need to turn the machine on, and with two hands just start to turn it up until you start to feel a sort of tingling or buzzing sensation. And just let me know when you start to feel that.
Oh, yeah.
Okay, so you can start to feel that. So then we're going to swap over. So I'll grab the machine and you take your boost button. This is your power button, and you just need to clip the machine onto anything that you've got. So pants, hospital gown, whatever you've got. Now in labour, you get a period of rest, and then your contraction starts to ramp up. When the contraction starts to ramp up, press your boost button, and what you'll find is there's an increase in sensation. So you're having a contraction, you're breathing, you're relaxing, your TENS machine is increasing, and then you'll start to notice the contraction drops down. Okay, once it starts to drop down and it's finished, press your boost button again, and then you'll find that it settles back down to that original, and that's how it goes. So at rest, it's a buzzing sensation. When you're contracting, you press your boost button, it ramps it up. What you will notice through your labour is that you will accommodate to the resting sensation. So you will need to turn this up as you go, and you can either do that or ask your partner to turn it up, and you just control your boost button. That's quite a good thing. And there is no unsafe level of the intensity of this machine. It's capped at what is appropriate. So you might find you go all the way up to somewhere like 80 through your labour, and that's absolutely fine. The other thing to note is that your skin must be dry when you put your electrodes on, and relatively clean. And when you take them off, just place them back on your plastic sheet, and you can absolutely use them for a second labour, so don't throw them out. If you love your TENS machine, you can use it again. The only thing in your labour that you can't use your TENS with is water. So if you decide to go into the bath, then you must take your TENS off. But apart from that, there's no limit to how long or how much you use your TENS machine.